How does urodynamic testing explain bladder behavior? Imagine trying to understand how a complex machine works without opening it up. That's what urodynamic testing does for your bladder. It's a set of procedures that help doctors see exactly how your bladder, urethra, and sphincters are functioning when you store and releases urine. This testing provides objective data that helps explain why you might be experiencing symptoms like incontinence, frequent urination, difficulty emptying your bladder, or pain during urination. For anyone concerned about bladder health or managing conditions like bladder cancer, urodynamic testing offers valuable insights into what's happening inside your body. To understand how this testing explains bladder behavior, it's helpful to know what each part measures. The bladder's main job is to store urine at low pressure and then empty efficiently when it's time. When you fill your bladder, it stretches and the detrusor muscle, which is the main muscle of the bladder, relaxes to accommodate the increasing volume. When you decide to urinate, the detrusor muscle contracts, and the sphincters along with the pelvic floor muscles relax, allowing urine to flow out smoothly. Any disruption in this coordinated process can cause symptoms or problems with bladder health. Urodynamic testing includes several different procedures, each designed to give specific information. Uroflowmetry measures how much urine you pass and how fast it flows. It's quick and non-invasive and can show if your bladder isn't emptying properly or if your stream is weak. Cystometry involves inserting a thin catheter into your bladder to measure pressure as it fills with fluid. This test shows how much your bladder can hold when you feel the urge to urinate, and whether the pressure rises abnormally during filling, which might suggest poor bladder compliance or overactivity. Pressure flow studies assess the relationship between bladder pressure and urine flow during voiding, helping to determine if there's an obstruction like an enlarged prostate or if the bladder muscle is weak. Electromyography records electrical activity in the muscles around the bladder and urethra, helping to identify nerve or muscle coordination issues. Leak point pressure measurements find the pressure at which urine leaks out, which is useful in diagnosing stress incontinence. Urethral pressure profiles measure pressure along the urethra to evaluate how well the sphincters are working. When these tests are combined, they give a detailed picture of bladder behavior. For storage, cystometry can reveal whether the bladder can hold urine at low pressure. If the pressure rises too quickly as the bladder fills, it might indicate poor compliance, which can happen after radiation therapy or surgery. High storage pressures can harm the kidneys over time if not managed. During voiding, pressure flow studies show whether the bladder contracts strongly enough and if there's any blockage. For example, in men, a weak stream with high bladder pressure might suggest an obstruction, while low pressure with weak flow could mean the bladder muscle is underactive. Electromyography helps determine if the sphincter relaxes properly when the bladder contracts. If it doesn't, it can cause incomplete emptying and high bladder pressures, especially in neurological conditions. Leak point pressure measurements help identify if urine leaks happen with coughing or straining, indicating stress incontinence, or if they occur suddenly with a strong urge, indicating urge incontinence. For those focused on bladder health or recovering from bladder cancer, urodynamic testing can be especially helpful. Treatments for bladder cancer, such as surgery or radiation, can affect how the bladder functions. These tests can assess the bladder's capacity and compliance after such treatments. For example, radiation can cause scarring, which reduces bladder elasticity, and urodynamics can detect these changes early. If symptoms persist after bladder cancer treatment, urodynamic testing can help determine whether the issues are due to the cancer itself, side effects of treatment, or other unrelated problems. It's important to remember that urodynamic testing is a tool to help understand bladder function, not a direct test for bladder cancer. Diagnosis of bladder cancer involves imaging, cystoscopy, and biopsy. The information from urodynamics guides treatment decisions, helps manage symptoms, and can prevent further complications. While the tests are generally safe, they might cause some temporary discomfort or a slight risk of urinary tract infection, so they should always be performed by trained healthcare professionals. In summary, urodynamic testing acts like a window into your bladder's inner workings. It measures pressures, flows, and muscle activity to explain what's happening during storage and voiding. This understanding helps doctors tailor treatments, improve quality of life, and monitor bladder health, especially for those with or at risk for bladder cancer. If you're experiencing urinary symptoms, talking to your healthcare provider about whether urodynamic testing might be right for you is a good step. Remember, every person's bladder is unique, and personalized medical advice is always the best approach.